When you are doing an intake with your clients, do you ever assume you know exactly what they're dealing with? And do you take that assumption into your treatment plan and just go for it? Well, if yes, I invite you to listen in to today's podcast because we're going to talk about our assumptions and what we really need to do with them in our treatment sessions. But before I do that and dive into that, I want to just let everybody know that this week is the last week for getting a discount on the internal pelvic floor course. This is a course where I teach you how to work with making sure someone's fully connected to the pelvic space before we do intravaginal work, learning how to enter into the pelvic space in a respectful way, looking for the body's yes and not just the mind yes, and also learning how to use the Schulte hold, the pelvic bone muscles, to help get the muscles, the pelvic floor muscles, to release. So know that that discount is ending on January 31st if you'd like to take advantage of that discount and check out that course.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
All right, so let's go ahead and dive into today's podcast topic, and that is leaving our assumptions aside. I had a client, I want to present this case study with you because it was so apparent for me that I had a client that came in to see me, and her complaint was very painful periods that started from the very first time she had her period in eighth grade. And the cramping that she would have would start a couple of days before the start of her period and last a couple of days into her period. Her periods were about 4 days long. There was never a really good flow. They were really clotty. And she also stated that she's never been able to insert anything into her vagina, whether it's a tampon or having intercourse, penetrative intercourse. None of that has happened because of pain. She gets a burning sensation when she attempts to do those things. Now, as I was hearing her intake and reading through her paperwork, my mind immediately went to the assumption I made was possibly we're dealing with endometriosis. So I asked her, has anyone ever talked to you about endometriosis? She's like, no, what's that? And so I gave her a little history on that or a little bit of information on that, what to look out for, and told her more about that. And then the pain with intercourse. My assumption is after hearing her, and she did have some high school boyfriends that weren't very kind and, created some trauma in her body. And so I was curious if she's ever had sexual abuse of any sort. So those were the two big pieces to the puzzle that were popping into my mind as we were doing her intake form. So endometriosis and possible trauma from sexual abuse. Maybe she had a history of that as a kid, but she wasn't aware of it because I did ask her that and she wasn't sure. And so, knowing what I know about listening to the body and how to approach our clients, I was able to set those two things aside and really just listen into her body and see where her body wanted to take me and to see what I found in her body. And the first thing that I did was we did a scan. I had her see if, a color could flow all the way down into her pelvis. I did a hand check to see where, is she fully connected all the way down to her pelvis. And when I got to the diaphragm, my hand was right on the diaphragm, and I just got this sense like, nope, can't go any further. Like I cannot move my hand down. And that's where we need to start and before we do any work in the pelvis. It's like we got to make sure that our clients are fully connected into their pelvic space before we go work in that space And that's just something that just resonates with me. And I just feel that when we're fully connected, we're going to be able to work with it so much easier. And the tissues are going to give us more information than when we're disconnected from it. So I had her bring her attention to her diaphragm and just tune in to see what she noticed in that area. And nothing, I wasn't getting any hits or any, I know in my body, the response to trauma that I feel in someone else's body is a tightening of my gut and a big ugh feeling like my stomach just drops. And I didn't have that as I was holding her diaphragm. And what I did get was a sense that her little girl, she did share with me as we were talking. And that's one of the things that I encourage all of you to do if you're not currently doing is please pay attention to their words because different words are going to light up for you. And that lighting up is important information, whatever they're saying. And she had said that she was really shy as a young girl, and that just felt really important to me. And as I had her tune into her diaphragm, she wasn't really picking up on it. Oh, no, she was. She actually said that there was a lot of fear, a lot of tension, like pulling up and in feeling in her diaphragm. And so we explored that fear in there, and nothing was really coming up for her. I asked her the question, at what age did this fear get implanted here? And her response was 13. And I actually got 4. Whenever I ask a question of my clients, I'm always listening to myself to see what my intuition, what my hit is internally, what I hear in my mind, head, whatever you want to call it. And I had gotten 4. I 13 just didn't resonate with me. And I really try to be careful when I'm working with clients. I want to empower them as much as possible. And I just knew 13 was the pain around the period. And that's when she started her period in eighth grade. I'm assuming that's around eighth grade is 13. I may be wrong on that. And I just had a sense that it was something younger, like it was from a younger time in her life. I asked her if she would be okay if we explored this 4-year-old idea, and she was. And I had her tune into the 4-year-old, and I just asked her what she felt, and she was like, "I'm really shy." And I go, "How do your parents feel about your shyness?" And she's like, "Yeah, they just don't get it." And I got that sense, and I go, it feels like your 4-year-old was just forced out into the world, like forced to be out into the world, and it didn't feel safe to her. And she just acknowledged, and I felt this nice, beautiful shift in her diaphragm as I said that. So I knew her body was on board with that idea. And we just helped that 4-year-old to know that her adult self was with her, and we just helped her process and give support and strength to that 4-year-old. And there was a beautiful softening of her diaphragm. I was then able to go beyond the diaphragm down into the pelvic space. And as I tuned into what I was feeling in her pelvic space, I had my hands coming in from the sides, one hand on the sacrum going across it, other hand parallel to the pubic bone, parallel to my other hand. And I was just tuning in, and I could feel that the uterus just felt large and it felt hard and just not a happy uterus in there at all. And I immediately, once I tapped into that, I'm like, I need to check out this sacrum. So I took my hands out from the side and I came between her legs and let the sacrum land in my hand. She was laying on her back. And I just felt how hard the right side of her sacrum was. I did some mobilization on the right side. I did some mobilization on the left side. And I encouraged her to see if she could sense a different side to side, and she could. I then encouraged the connection between the hard side on her right side and the uterus. And I didn't do it in the direct uterosacral ligament way that I teach. I just kind of held it and I felt a softening. And then I was like, no, I really need to do the uterosacral ligament release. I did that one, and there was a beautiful melting of that uterosacral ligament. I felt the sacrum on the right side soften. And then when I compared it to the left side was hard in comparison. I gave the left side some love, some attention, and hardened bone loves compression, everyone. So figure out a way to compress the bone in whatever way it will allow that hardened bone to release. The sacrum got better, and then I just tuned into the uterus. And we just gave the uterus some attention, some love, and it just kind of melted. And there was nothing else that was coming up for her. We were running out of time at this point in this session. And I felt that there was this beautiful release and let go. And I didn't feel like we had time to do anything more. I just invited her to come up off the table and to move around. And she felt so much lighter in her pelvic space. And she was able to move around and notice just like the heaviness that was there just wasn't there anymore. And she felt so much more free in her pelvic space. After we got done with the session, I was talking to her about I'd love to see her again. There's definitely more that we need to do here. And I would like to see what happens after her period. We're waiting. She came to me mid-cycle, and in 2 weeks she'll have her period. So I'm going to see her after her period. And I did reach out to her yesterday to see how she was doing. And she said that she was feeling so much better, so much lighter in that pelvic space. However, she was waking up every morning having some cramping for a little bit, and then it would go away. And I just replied and said that, maybe things are still trying to figure out how to settle in there and we just needs a little bit more attention. So I'll be very curious to see what happens when she does have her period and we'll go from there. And the big point that I wanted to make about this case, and the reason I'm sharing it with you all, is because I had to set my assumptions aside. I'm not sure if it could be still endometriosis. That could still be the issue that she's dealing with. And I think I'll know more after she has her next period. And the tension in her pelvic floor muscles, while I didn't do anything internal and I didn't even check into the tension in her pelvic floor muscles, I wonder if it's not sexual abuse or sexual, her being raped or something like that. It could be that her body and her pelvic floor were tensing up because she was getting thrown out into this world, not in a way that was supportive to her shyness, to her energetically. It was too much, too fast, too whatever. And it could be as simple as that. I just want everyone listening to this podcast to keep in mind that it may not be our assumptions. I know we've been in this, for those of you that have been in this field a long time, we've seen a lot of things, and there can be patterns, there can be similarities between cases, and yet it can be something as simple as her 4-year-old girl not feeling safe being pushed out into the world and not in a supportive way. And that's what's creating so much tension in her pelvic floor and in her diaphragm. So please keep in mind to observe your assumptions with your clients, but please set them aside and bring neutrality to your work with the body and let the body give you information. Let the body guide you and follow the body and see what happens and see if your assumptions are correct. All right? So that's the tidbit for this podcast is to please make sure you set aside your assumptions and be present with what the body wants to show you and work with what is coming up in the body. Okay? Thanks, everybody. Hopefully, I'll do another episode if it feels important enough. I'll do a follow-up episode on this case at another time. But the assumption piece was so huge for me that I just wanted to make sure I got this information out before knowing her entire story. All right. So thanks everybody for listening in. Please check out that internal pelvic floor course. You'll learn how to feel for the blocks. How to work with the blocks is actually taught in my birth healing intensive program, but you'll also learn how to enter into the pelvic space in a respectful way, how to work with the pelvic bones and the pelvic floor muscles together. And it's great for new practitioners of doing internal work and those that have been doing work for a long time. You will still learn something with this course. All right. Thanks, everybody. Take care, and we'll see y'all in the next episode. Bye bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.